So imagine you're seeing someone who's just lost someone close to them. Maybe they're going through a bereavement reaction or a grief reaction. Let's go through some of the steps that they may be going through and steps that you need to recognize as normal steps. Because if you recognize what's normal, you can then hopefully recognize what's abnormal or atypical reaction, which is where we need to get involved. Now remember, steps may be different from one person to another. There may be additional steps in there as well. Timelines might be different. But again, let's go through some of the common things that we see. So shock and denial usually up front. What just happened? Feeling of overwhelmed. How can this happen? How is it possible? A very normal initial reaction. That may lead on to anger. So that could be anger against themselves. It could be anger to the person who's passed away. It could be anger to relatives. It could be anger to medics. An anger reaction is quite a normal part of a typical grief or bereavement reaction. Then you may go on to a bargaining time or guilt maybe. So guilt, thinking back to the last few years or weeks, what they've done, how they may have done things better. Bargaining, what if only, could I do something to change things, X, Y, Z. Very important part of a normal grief and bereavement reaction. Depression naturally will follow. It's going to be a period of depression. You've just lost someone close to you. That's quite normal. But again, we need to be looking out for signs of prolonged or atypical depression, which is where we may need to come in. And finally, you get to the acceptance stage where you start to think about moving forward. We start to become okay with the situation and start thinking about the future perhaps. But again, different people will react in different ways to these things, but these are all quite normal parts of a bereavement reaction. At all stages, whenever you see them, think about support systems. Have they got a support system in place? Do I need to be offering a support system? Things like bereavement counseling or support organizations, or do they have friends and family around them they can talk about these things to? What is their support system? And it's always really important to reassure that these are quite normal steps. They may be thinking, I'm the only one going through these things. Why am I feeling anger? Why am I feeling guilt? Reassurance is a strong part of this. But again, look out for signs of atypical bereavement or atypical grief reactions, which is where we may need to get involved a little bit further. But I hope this helps. #CanPass, will pass.